Prefabricated posts. Prefabricated metallic posts are frequently used as a fabrication of a direct foundation restoration. These posts are classified several ways, including the alloy composition, retention mode, and shape. Materials used to fabricate metallic posts include gold alloys, stainless steel, or titanium alloys. Advantages of prefabricated post core systems over cast posts. They are simple to use, require less site time, can be completed in one appointment, are easy to temporize. Major disadvantage of a prefabricated post core system. The root is designed to accept the post rather than the post being designed to fit the root. Their application is limited when considerable coronal tooth structure is lost. Chemical reactions are possible when the post and the core materials are made of dissimilar metals. Attachment for removal processes cannot be applied unless a separate casting is fabricated to place over it. Advantages of cast posts over a prefabricated post core system. They are custom fit to the root configuration, are adaptable to large, irregularly shaped canals and orifices, can be adapted to use with the prefabricated plastic buttons. Disadvantages of cast posts. Expensive, requires two or more appointments. Temporization between the appointments is more difficult. The risk of casting inaccuracies may require the removal of additional coronal tooth structure. Metallic posts. Stainless steel posts have been used for a long time and prefabricated posts contain nickel. Nickel sensitivity is a concern, especially among the female patient. A recent study indicates that the flexural strength of a stainless steel post is about 1430 megapascal and the flexural model is approximately to 110 GPa. And stainless steel and brass have problems with corrosion. Titanium pools are less rigid. Flexure strength is similar to the stainless steel, less corrosive, are most biocompatible, low fracture strength, and tend to break more when compared to the stainless steel pore during the removal and the retreatment cases. Titanium alloys used in the pores have a density similar to that of Gatapaka when seen on the radiograph, which makes them more difficult to detect. Non-metallic pores. Fiber pores. A fiber pore consists of reinforcing fibers embedded in the resin polymerized matrix. Monomers used in the form the resin matrix that are typically bifunctional methacrylase, but exploits can be used. Common fibers in today's fiber pores are made up of carbon, glass, silica, or quartz. The fibers are 7 to 10 micrometers in diameter and are available in a number of different configurations, including braided, oval, and longitudinal. The lower flexural modulus of fiber reinforced pores measures closer to that of dentin and can increase the incidence of root fracture. Current fiber post or radio opaque and may also conduct the light for polymerization or resin-based luting system. Light transmission, light transmitting post results in the better polymerization of the resin composite in the apical area. Bonding fiber post to the root canal dentin can improve the distribution of the post applied across the root, thereby decreasing the risk of root fracture and contributing to the reinforcement of the remaining tooth structure. Carbon fiber posts they were introduced in the early 1990s and is comprised of longitudinally aligned carbon fibers embedded in the epoxy resin matrix. This type of post has no radio opacity and is black in color, both significant clinical disadvantages. In the prospective clinical trials, more failure was seen in the carbon fiber reinforced posts than those with conventional prefabricated posts. Also, a long-term follow-up of 236 teeth in the favorable Fredrickson report concluded that the carbon fiber restored teeth had shorter survival times than those of previously documented for the cast posts. Zirconia posts are composed of zirconium dioxide partially stabilized with the yttrium oxide and exhibit a high fluctuation. Zirconia posts are aesthetic, partially adhesive, very rigid but also brittle. Zirconia pores cannot be etched and available literature suggests that the bonding resin to these materials is predictable and requires substantially different bonding materials than conventional ceramics when the composite core is built on a zirconia core. Uh, when a composite core is built on a zirconia core, the core retention may also be a problem. Other reports indicate that the rigidity of the zirconia pores negatively affects the quality of the interface between the resin core material and dentin when subjected to the fatigue testing. Active pores derive the primary retention from the root dentin by the use of threads. Most active pores are threaded and are intended to be screwed into the wall of the root canal. Major concern about the threaded pores are potential for the vertical root fracture during the placement. As the post is screwed into the place, it introduces a great stresses within the root, causing a wedging effect. Therefore, it is generally accepted that the use of threaded posts must be avoided. Active posts are more retentive than the passive posts and can be used safely only in the substantial root with maximum remaining tension. The use should be limited to the short roots in which maximum retention is needed. Passive posts are passive placed in close contact with the dental walls, and the retention primarily relies on the luting cement used for cementation. Parallel and the tapered post, a parallel post is more retentive than a tapered post, but also requires removal of more root dentin during the preparation of the post base. The lower retention obtained with the tapered end post is attributed to the lack of parallelism in the apical portions. Although tapered post shape requires a less dentin removal and is more consistent with the root anatomy, a growing body of evidence suggests that the tapered unbounded post exerts a wedge effect that puts the root at risk of fracture and predisposes to the loss of retention. Thank you.